Hello, everyone. My name is Valerie Manu. Welcome to today's webinar, Phase 3 Childcare Guidance Briefing. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded. We will share the recording and PowerPoint with webinar registrants after the session. All participants are placed on mute for quality assurance. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. And with that, I'll turn it over to Kathy Glazer.
Thanks, Val, and good afternoon, everybody. So glad you're able to join us today to get some more information about Phase 3 guidance for childcare providers. And we also have a wonderful treat in store for you today, and being able to hear from 3 providers who've had experience in continuing to operate and in dealing with and managing the guidance and the changes along the way. As we get started, we will hear from Jenna Conway, who will give us the information about the minor changes that are in place with Phase 3. And then we'll shift and hear from Lisa Payne-Wells, Tracy Walters, and Angela Rouse as providers. So we'll get started, and I'll turn it to Jenna.
Excellent. Thanks, Kathy. Before we get started, I wanted to again express my appreciation on behalf of multiple state agencies. I sit between the governor's office and the Virginia Department of Education, working very closely with Commissioner Storin, Tara Reidlin, and the licensing crew at the Department of Social Services, and then of course working very closely with the Virginia Department of Health in making sure that all guidance reflects the best public health practices. We are, I think, in week 15 of response to this pandemic, and we know folks are exhausted, fatigued. We know the information continues to change as we learn more about the virus and its effect on kids, on families, and on the early childhood system. And so just wanted to start off and with a thank you and a recognition of the incredible work that folks have done on the phone, either sustaining families and kids throughout this period or as they are reopening. Also, wanted to acknowledge that, as this guidance shifts, we continue to learn more from you, from our stakeholders. And so we're so deeply appreciative of the folks who participated in listening sessions, who reached out, emailed, called, and kind of let us know how this is affecting them and how we can better support you as we reopen. And Valerie, if you'll move to the next slide, please. What I'd like to do in my brief time is give you an update on the current situation, to just walk you through the landscape as it relates to childcare, family day homes in the state right now, where we're at. Then talk a little bit, as Kathy noted, about our Phase 3 guidance, some of the key changes and updates there. Talk a little reminder on facial coverings and kind of making sense of the rules, regulations, and guidance out there. Talk briefly about a partnership that was put forth this week, just formalizing the efforts across the Department of Health, Social Services, and Ed to work very closely with our family day homes and childcare centers to contact trace. So as more and more programs are opening, and as we have hearing of confirmed cases, as we heard on the news this week, what we're doing behind the scenes to reduce the spread. And then talk about, as we sort of what we've done to prepare for Phase 3, and potential additional CARES Act funding that we will hopefully be announcing shortly in terms of support to the field. Next slide, please. So as of July 1, so we are moving into Phase 3 today, July 1st. Thought it would be important to provide you an update with where we are as a state as we are gradually reopening childcare. So you'll notice for those of you who've been on these calls before, we've shifted our language slightly from saying how many programs are closed to a more optimistic how many programs are open focused. So right now we've got about 45% of our larger childcare centers open, 42% of our religious exempt or faith-based preschools are open. We know that these numbers are slightly different since some of these places are closed generally during the summer. And then a whopping 83% of our family day homes are open. This represents progress. We still have a lot of closed programs, roughly about 2,300 across the state, but that's down from our all-time peak of 2,600 programs closed. Altogether, this represents a loss in capacity of about 180,000 slots across the system. Still a significant difference from where we typically are, but again, a real improvement from where we were about a month and a half ago, where we were at over 210,000 slots. So we really, in the last month and change, brought 30,000 slots back into the system. So that's really, really important in terms of our overall capacity. 600 programs have indicated to licensing that they have a reopening date. So that's really, they're opened or have a reopening date. So we're sort of seeing each day more and more programs are letting licensing know that they're coming back online. And we see that sort of across the board, child care centers, religious exempt, as well as family day homes. We continue to ask and make sure all of our, whenever the governor speaks about childcare or schools, to remind people that childcare is open for all families right now. Our childcare educators are essential personnel, and really we're sort of seeing kind of more and more demand across the system. Our priority areas remain the same, making sure and tracking closely, working with childcare, aware of Virginia with the Child Care Association, with our Smart Beginnings partners across the state, to make sure we have enough childcare as personnel return to work. As I said before, it's a sort of stair step, bit by bit, day by day, 10 centers coming back online, 15 programs coming back online, but we're carefully monitoring it as we sort of face some major milestones that are going to come up. So there'll be a sort of a change in terms of the federal unemployment at the end of July. We know that lots of school divisions and Head Start programs are talking about reopening in August and sort of even into sort of early September. And we know that as well as employers are starting to call people back to the office or increase expectations on, folks need to be working, meaning that they need childcare. And so this really has been a continuing to be kind of a challenging dynamic, sort of to keep track of what's the demand, what's the supply, where's parents' fear at, but we are monitoring it closely. And using the $70 million in CARES Act childcare funding to support the field. And so we have just over 2,300 programs that were approved for the first phase of this that really covered April to June in terms of a cash assistance program to any type of childcare program that is open. And we hope to announce next week, and I'll talk a little bit more about this at the end, later than next week, a second phase of that will help cover the period of July to September. So we know that, as you've heard us talk about a lot of times, we understand there's a higher cost of operating. We know that your revenues are still down because all families haven't returned for the most part. And so trying to figure out how we can use any new federal dollars to support the field is a top priority. As I say, most of these presentations, we are very serious about getting these resources out to the field. We also recognize that the dollars that we've gotten allotted from DC do not even begin to cover the financial losses experienced by many of the folks on the phone today. And so with whatever advocacy efforts that there are happening in Congress and in DC right now to get more dollars, we completely support those. We think more resources are needed to be able to support the enormous impact of the COVID-19 pandemic on the childcare sector in the Commonwealth. Next slide, please. So with that, wanted to provide a high-level update on Phase 3 guidance. On June 25th, the Department of Social Services issued guidance. If you click on that link, or if you go to the main webpage for childcare for COVID, you'll find this guidance. It's brief, and as Kathy noted, there's not a lot of significant changes. We as a state moved fairly quickly from Phase 2 to Phase 3, and based on what was available at the time, based on conversations with the Department of Health, and what was aligned with schools, we felt it would be safer to kind of to provide a limited set of shifts, but not to go back to kind of the typical, for example, ratios and group size. We still think there's a need for physical distancing. We still think there's a need for enhanced health and safety, kind of cleaning protocols, and still a need to, address the fact that, with this, even though at a slower rate, this is still a highly contagious virus that has not gone away. And I think this is all done in context, although Virginia data looks good right now. When you look kind of relative to the other states, we still have really kind of deep concerns. Obviously the increase in cases across Florida and Texas and California, means that this has not gone away, and wanting to be really cautious that we don't get back in a sort of a shutdown place, right? I mean, nobody really wants to go back to where we were in March and April. So the guidelines focus on the physical distancing, and you'll probably start to hear that term as much as you hear social distancing. I think the real kind of, probably a better way to say it, disinfection, cleaning, use of facial coverings, a lot of that remains the same. Group size, and we'll talk about that in a second, but we've basically kept them the same as phase 2, largely based on what we understand about the challenges around physically distancing young kids. And so I'll talk a little bit more around kind of kids sort of 3 and under as compared to school age kids or preschool or school age kids. Swimming pools and water activities, this is a change. So phase 3 allows free swim in addition to instruction and exercise. This calls for 10 feet of physical distance, between sort of children that are not in the same household. So, but again, for those of you who are running day camps, for those of you who typically go to pools or involve pools, really kind of trying to keep, you can have free swim, provided you're keeping kids apart. And then use of sort of the more municipal kind of, the water countries, the sort of the splash pads is still prohibited. I will say, as we heard Tara talk about last time, we know that folks are doing water days at day camps and at childcare, right, with sprinklers or those sorts of things. As long as you're keeping kids apart, that's fine. This is really sort of more specific to like the larger municipal interactive water features or water countries than it is for, sort of when you have like a water day at childcare or family day home or summer camp. And then field trips, these are allowable, and there's a few bullets in the guidance on how to think about that. Again, sort of aligning with the school guidance, which kind of gives a little bit more flexibility. If you can't do it safely, we're encouraging you to continue to delay participation, in sort of field trips, intergroup events, extracurricular activities. However, if you do, make sure you keep the physical distancing. We offer some guidance on transportation, really thinking about, in that sort of the place with like the most limited airspace might be that van or that bus, that small bus. And so really being thoughtful about, how do I keep the kids apart from each other? Should I have the kids wear masks if they're old enough on the bus? How do I clean the bus between groups? You can have, for instance, the same driver drove back and forth, but don't want to mix a bunch of groups on the bus if you've done such a great job of kind of keeping them separate at your sites. So again, some more flexibility here on field trips, so that, if you want to add some of those in as we get into the summer, we know that those can be such an exciting and important events for kids and families, and so it gives you some flexibility to do that here. Next slide, please, Valerie. So we've heard, and just want to kind of explain where we are and why we stayed with the same group sizes for phase 2 and phase 3. And so, as some of you know, we've had conversations with our stakeholders across the state. We've continued to work very closely with the Department of Health. We have been monitoring what other countries and other states have done. We were one of the earlier states to go above the group size of 10. A lot of states were sort of staying there as of when we sort of shifted into phase 2. And based on what we know about physical distancing and what we know about kids, we felt it would be safer to keep the same group sizes that we had for phase 2. We had some good evidence, and we've looked at the kind of cases, the confirmed cases, the transmission, what's happening on the ground in childcare. We knew things looked really good when we kept a rule of 10. We saw sort of it was a promising sort of trend in terms of increasing the group size, but we were hesitant to kind of, particularly for kids under 4, to go back to, the larger groups. And so the group size limit remains 12, including staff, for kids under 4, largely because these kids really shouldn't be wearing masks, or if you can, although it might be sort of physically safe for a 3-year-old to mask, keeping masks on 3-year-olds is probably the hardest age. And again, sort of keeping those kids apart is really, really difficult. And so for this point in time, we're going to keep the group size for younger kids to be 12. More flexibility for the older ages in terms of going up to the kind of the larger number here. And as long as you are maintaining that physical distancing and you're, of course, following all age-based ratios. Groups of children can share the same physical space, as long as you're really trying to keep the groups separate, and that the kids do not mix between the groups. We understand, a kid may run across the room. It's not a big deal, but just to the greatest extent feasible, trying to keep those groups separate, particularly if you've got sort of larger groups, is important. Continuing to encourage outdoor play. We know that the rates of transmission are much lower outside. And so really sort of, trying to maximize your outdoor space, you can take multiple groups out at the same time, trying to keep them apart from each other is the goal there. But we do know that kids love to be outside during the summer, and we also know that the kind of outdoor transmissions are much lower. And so you see kind of sports and other things, happening across the state. So two kind of points to add to this sort of, in terms of Virginia generally staying similar to phase 2 for where we are. I think the first is, the commissioner has the ability and the department to grant variances if there are clear cases where, for instance, like you have a family who desperately needs to kind of come back, you need to serve more 3-year-olds, and you have figured out, how to keep the kids apart or have, an approach for keeping your kids, your staff, and your family safe, those can be considered as variances on a case-by-case basis. And so again, for the most part, when we look at what's happening nationally, when we look at what's safest in partnership with the Department of Health, the preference is to stay, within these group sizes. If, however, there's a real limit of supply within your community, you need to be able to serve more kids, and you can demonstrate to the department how we can keep kids safe, those variances can be considered. And so just want to remind folks that is always a possibility if you've got a unique circumstance. The other point that I'd like to make here is this is the phase 3 guidance, as of today. And what we're seeing for both the child care guidance and for the Department of Education guidance is that we're just, as we've reopened, we're learning more and more about, the sort of how to reduce risk, but also keep kids safe. And when we were in total shutdown mode, we sort of had one sort of set of evidence about this. And now as we've been open, right, states like Virginia have been open for longer, we're learning more. And so you can expect that we might, sort of get some shifts here. And I'll give an example of something that you can expect that might come forward. About 5 days ago, the American Academy of Pediatrics put out some guidance to support schools and childcare that had some evidence suggesting that transmission might be equally low if you had kind of kids in sort of desks or at tables 3 feet apart and were wearing masks. So when they looked, that's very early evidence, but basically suggesting that you might be able, if you reduce the risk in other ways, to go below the 6 feet. And so we are looking carefully at that. We are working closely with Department of Ed, Social Services, and Department of Health to see if we should come out with some additional guidance suggesting that, although the gold standard is still the physical distancing of 6 feet, there might be some scenarios and where it could be safer to have fewer feet between kids if, for instance, the kids are wearing masks. Obviously, that's more more relevant for older kids, right? Who can wear masks. But it is, again, anything new that comes out, whether it's from the American Academy of Pediatrics, the Center for Disease Control, or our own Department of Health, we are looking at, can it be applied in Virginia, and we'll continue to adapt the guidance as it goes forward. So as it stands right now, these group size remain. As it stands right now, the expectation for physical distancing is 6 feet. But as we learn more, we remain committed to bringing that information to you and potentially being willing to revise the phase 3 guidance, based on advice and guidance from our public health experts. So just to sort of restate from the top, the phase 3 guidance is out there. It's roughly about 6 pages. It's on the website, which is listed right here at the bottom of the page. Not big changes as it relates to group sizes, more flexibility as it relates to swimming and field trips, and the general rules that remain the same around physical distancing, more cleaning and sanitation, and wearing facial coverings, we'll talk about in a second, all remain the same. But you can expect that as we learn more from our public health experts, we will revise. And so if you see a change, for instance, in school guidance, you can expect that we might have sort of similar changes for childcare. Valerie, next slide, please. Just a reminder, we've covered this before, but the facial coverings thing is confusing and complicated, and wanted to kind of to clarify sort of who must, who should, who may. So the must on facial coverings really pertains to customers of places, right? If you go into your Walmart or Target now, you have you're visiting there, you have to wear a mask. And we know that some stores are kind of kicking folks off if they don't wear masks. What that really means for childcare right now is that, family members, right, sort of who enter childcare and camp facilities, should be wearing a mask, or any other visitors or non-employee visitors. So that's the must. That's what the executive order requires. What is recommended, but not required by the executive order, relates to really your staff and kids over the age of 2. So really thinking about where kids can't be, or sort of adults can't be apart from kids. If you can't maintain the 6 feet, please make sure staff and sort of, to the extent feasible, kids are wearing masks if they're over the age of 2. Particularly, we know there are more transmission inside, right? So they're thinking about ventilation, sort of keeping kids outside as much as possible, but being, if you have to pick a time to get kids to wear masks, that would be inside time, not outside time. And the who may, you can always, if you want to have your folks wear masks all the time, you do have permission to require that as a programmatic requirement. There's flexibility. The only one where we sort of really encourage you not to have them wear masks is if you've got young children, under the age of the 2, they don't wear it properly. They're kind of concerned about suffocation. If you've got staff, right, who are, sort of kids who've got sort of conditions that would mean that there are respiratory issues, and then you got kids sleeping, or if the kids are sort of incapacitated. So again, there's a set of times where you really don't want kids wearing masks, with the key factor for that being any kids with sort of health conditions that may mean it doesn't make sense for them to wear a mask, or their mom, dad, or doctor says they shouldn't wear a mask, and then kids under 2. And then it is not required that staff or kids wear masks. It is encouraged if you've got folks inside and they're not able to maintain the physical distancing of the 6 feet. All right, next slide, please. So another important announcement, and just something we wanted to get out to the field, is as folks are reopening, we wanted to make sure that everybody understands the partnership in place to do contact tracing. So you've probably heard these words before, but basically we know that we can't get to a state of zero risk, right? COVID is here and will be with us, until there is a vaccine. But there are things and the practices that we've asked you to put in place in your centers that can help slow down the spread. And then if you do have a confirmed case and it does come to your center, we can do contact tracing to sort of limit the spread, right? So, inevitably we've had it in childcare programs since they've been open. We will have it, more in childcare centers. We will have it in schools. Like that's a sort of inevitable in terms of how the virus works. But what we are doing is working closely with VDH to trace contacts to sort of reduce the further spread. So there's a new document on the Department of Health website, and we'll send the link out afterwards. And also, if you click on the blue words there, the blue word there, it takes you there. But it basically walks through how the Department of Health will work very closely with you, your local Department of Health, schools, family day homes, Head Start, everybody serving kids, to make sure if you have a confirmed case, that we can quickly track everybody who has had a contact with that case. And so we know some of you have had this happen. Some of you may be kind of having questions about how this will work. But basically, if you have a confirmed case, whether that's a kid, it's a staff member, that's a family member of a kid who's attending your center, the key thing is to let your local health department know as soon as you have a case, right? And just contact them, make sure you know that number, make sure you have somebody at your site who's identified, right, as the person who's going to be that primary point of contact. If there's a confirmed case, then it clicks in, and I believe it was announced yesterday, I think there's already 1,200 contact tracers. So these are folks who have been hired by the Department of Health, whose full-time job is just tracking down folks, right? And really kind of making sure that anybody who's come into contact with a case is aware of that and understands what that means for them in terms of quarantine, can get some advice, can ask questions, and then is referred to get tested. And so they'll contact the point person. They will reach out if you've got, for instance, a confirmed case at your site, and they will really say, okay, who has this child or person been in contact with? And a contact really counts at being within 6 feet of a person or a child for 15 minutes or more. So if it's somebody who just, passed through your center, and was never within 6 feet of your kids or your staff, then that wouldn't count as a contact. So you have to be within 6 feet for 15 minutes or more, and that counts as a contact. So if you, for instance, had a kid who had contact, that they would do is they'd call and they'd ask for your help at the program. Who would this child have been in contact with? Who are the other kids in the classroom? How does it work in your classroom? Is it sort of younger ages where we know that they've often been within 6 feet of each other? What's the contact information for those families so we can let them know? What staff might be in contact, right, for 15 minutes or more within 6 feet, but basically kind of getting all that information from you so that they can then make all of the phone calls and follow up. They have, and the reason the document from the Department of Health is 9 pages, they have a whole lot of kind of language in there about why they're legally authorized to get all this information from you, how they protect the privacy. There's certain rules that they have to follow around. They obviously don't talk to 2-year-olds. They talk to people's parents or guardians, right? They'll ask you for this information. They are required by law to keep all of this highly confidential. So you should know that there's a whole bunch of rules and regulations that guide how they do this, but that and all of their procedures, which they've been really kind of established over the course of the last 3 months, balance between protecting confidentiality of everybody involved, but also making sure that that they're really reaching out to anybody who's had a contact, right? Because the way to stop the spread, the way to kind of, keep community sort of safe is to let everybody know, to encourage everybody to quarantine, make sure everybody gets tested, and that really helps slow down the rate of community transmission. So wanted you to know that this exists. I think the key asks for our child care programs and family day homes are make sure you have the number of your local Department of Health. If you're a larger program, make sure you've identified somebody who will be your point of contact, right? If you get a case, because what you'll do is you'll call to make the case, And then you'll probably get a call back, right? And they'll want to know, they'll ask you these questions about who had contact. I think it's important. I know that I'd be curious for some of our child care providers who are joining us today, making sure you have some understanding, right, of sort of where folks are. You've got your attendance logs. You're sort of thinking about who's in a room, right? Because if you get called, they're going to ask you that question: who has been in 6 feet of this child or this staff person for 15 minutes or more, right? And so really making sure that you've got some way of tracking that and keeping sort of a track of that in case you've got a case at your center. They will also help you, right? If you have a case and you realize that, for instance, I have a case in, the toddler room, but my toddlers never, came into contact with my 3 and 4-year-olds, or never came into contact with my, with my summer camp program. They'll help you and then sort of be able to sort of walk you through the guidance you can give to the rest of your program. You might not need to shut down your whole program. You might be able to kind of contain it, to a particular classroom, and your VDH and your local Department of Health can then help you make that, that best determination based on your center, your kind of context of what's happening. So this has been happening, as I said before. There have been confirmed cases in childcare, sort of a small number relative to all of the programs that are open and the kids that are being served, but wanted everybody to know that we have put in place a specific protocol and policies, wanted you to be aware of them, and then know that there's lots of rules and laws in place to protect confidentiality of kids and your staff and your parents, but also we're doing this to make sure we can slow down community transmission, all in the aim of avoiding, a shutdown, going forward. Next slide, please. And then lastly, as we sort of call this sort of managing phase 3. So as I said before, we are continuing to learn more as places are open and serving kids about, what are the best ways to allow you to serve as many kids as possible, right? Because we know that that parents need a place. We know that kids' mental health and sort of social emotional health and development, is better when they can get back to care. I talk a lot about, when I'm talking with superintendents and others, about just the positive story we've heard from providers when kids can get back, families are ecstatic, and it's just such a great feeling when kind of kids can get back. And so we think that we will likely have some changes to the phase 3 guidance as we learn more, and we welcome any input. You can always email me, you can talk to your licensing inspector, but kind of continuing to get the feedback. We work very closely with the Department of Health as well as local departments of health, right? To just this key focus is around keeping our kids, our families, and our providers safe, but also recognizing, right, that we want to allow you to serve as many people as you safely can, and minimize the regulatory burden there. And we know that the financial impact has been just catastrophic. And so we have run the numbers on how much has been set to go out, in the first CARES Act funding between April and the end of June. And we know those checks are coming out, not as quickly as we would like. And there's getting all of those checks out the door so you can get your April to June funding. And we are preparing to make an announcement on the remainder of the funding, with the main goal that we get all of or nearly all of the $70 million out to the field by the end of September, so we can A, support you, and B, continue to say to the feds, right, we've gotten these dollars out, but the need is still there. The need is still great. We need more federal resources to be able to support our child care partners who are really providing just essential services to kind of kids and families, and enabling the system to remain open. And that, as always, is the link where we put the up-to-date information there. And with that, I will turn it back over to Kathy. I'm not sure if we want to do questions now, if we want to hear from our providers first. Very flexible on how we want to move forward.
Thanks, Jenna. Appreciate that. We do have a number of questions. I think I'll ask a few of you now, and then some of them may be more better answered by our providers, but let me ask you a few. We have several folks who have asked questions about, are there any statistics on how many coronavirus cases have been reported in child care centers, and is that staff or children, or what kind of numbers do we have?
That is a great question, and one we are currently working on. I think in the kind of, that's partly what led to a more formal model around the contact tracing. We've had folks who have done a great job of reporting to licensing. We've had some folks that have reported to local departments of health, and so we are reconciling those numbers as we speak. Right now, those numbers range in the sort of the tens, right, between potentially sort of 30 and 50 cases, right, out of a capacity of several 100,000. So we think it's very low, but we are working to get some numbers on there. And again, similar to what we're seeing nationally, it's been more adults. So the kind of, as the AAP put out in their guidance, the evidence out there in the Virginia data sort of shows this as well, is kids are much less likely to be symptomatic. They're much less likely to have serious disease. They're much less likely to become infected and to spread infection. And so we've been really paying more attention to the staff cases. And again, we have not seen a lot of transmission either. So it's more around an individual might pick it up somewhere else and happens to work in a center than it is a lot of kind of within site transmission is what we're seeing. But we're working to get those numbers and think about how we can share those numbers more publicly.
Thanks, Jenna. And then I'm sure you'll not be surprised, a number of questions about if folks have applied and are still waiting for funds for April to June payments. Does that mean that they will still get it? Will not? We'll just ask you to sort of make a statement that might answer a number of questions about what expectations should be for providers who have not yet received their check for the April to June timeline.
Yeah, no, that's a great question, and I think we hit some unexpected bumps in the road less around the approval process and more around the actual kind of cutting of the checks and getting those out to the field. So several hundred have gone out, but as you heard me say, right, we've got 2,300 approved. The dollars are there. We have been very thoughtful in our accounting for all those dollars before we would make any additional announcements. So you shouldn't worry about that, like similar to some other things where like you run out and you won't get your check. It's just been slower than expected to actually get those checks out the door, but they are coming. And if you have been approved, you do not need to worry about it. And again, hopefully next week there will be more news on the kind of the next round of assistance. But if you've been approved but just haven't gotten your check yet, please know that it's coming, and we apologize for the extensive delays in receiving this cash assistance. We know the kind of intent was to get it out quickly so that you could address your short-term needs, and we know that it's taken much longer than it should have.
And Jenna, just one more question along those lines. For any potential future, grant opportunities, will they likely need to reapply?
That is a really good question. I will answer it with the criteria are not likely to change, but we'll have to look at the mechanism for getting the checks out. Like we might, just depending on how we do that, we're trying to figure out how we could do it more quickly in round 2. So that might entail some form of reapplication. But generally what people liked about this was that it was sort of went beyond subsidy. It was sort of direct cash assistance, and that there weren't a lot of strings attached on sort of how to use the dollars. So we'll want to keep that the same. What we didn't like is that the checks, have taken a really, really long time to kind of get. And so we're trying to figure out how we can resolve that and make it as easy as possible for folks to apply.
Thanks, Jenna.
If they need to reapply.
Here's another question a little bit outside of what you've talked about, but probably very much on people's minds. As localities weigh their options for K-12 reopening, we're hearing from a lot of members, and this is from VACO, that they're worried about the childcare community in their communities to absorb an increase in students who normally would be in the school setting during the regular week, but because of tiered or distance learning to mitigate the risk will now be at home. This is especially a concern for the K-5 cohorts. Are there any resources or a contact at the Department of Education that they or their school boards or superintendents should reach out to help formulate childcare plans for these populations?
Yeah, that's a great question. So I think I'm the right contact at the DOE in terms of the person who is point and working very closely as we get plans in. I think, the challenge right now is we don't have plans yet, right? And so I'll just take it back a step, but the department put out, 100 and some pages on kind of guidance for phase 2 and phase 3. Most school divisions, have not reopened in phase 2. And so phase 3 hits today, and they're really now focusing on, what their plans look like most immediately. We do have some places that have opened extended school year and sort of are serving kids back in person, but I'd say the majority are in the process of planning for the fall. And, in that stage of engaging families, and sort of thinking about, what the sort of the options are, all virtual, hybrid, whether it's like mornings and afternoons or off days or, sort of A days, B days, off weeks. And we have asked them to reach out to local folks when they think about childcare. We really, based on what we learned last time, is we want our school divisions to go to the experts first, to go to open childcare. I think that we're finding that this sort of it's a pretty difficult scenario to imagine kind of the covering the hybrid. And so there's really encouraging our superintendents to work closely with providers around, like, how would you safely cover the off days, if that's going to be the model where you land. If in fact, kids cannot just stay at home, right? I think it's a different scenario if you have, you're just going mornings and you're then going home in the afternoon. But if you have kids going all over the place, some of this work to kind of keep these groups smaller is not going to be effective. If you've got, a kid is really, instead of just kind of being in one pod for the week and they're just going to school and then coming home, if they're then going to various different other places, to kind of provide coverage, right? As we talked about with the K-5, we are worried that it might increase the risk of transmission. And so right now it's hard to kind of to speak definitively, right? Because everybody's still making their plans, but we are trying to make sure and working closely with our superintendents who we speak to once a week, our Smart Beginning partners, and with our childcare folks locally to make sure that superintendents are opening those channels of communication to childcare before making sure they're reflecting that to their school boards before making any decisions on how they're going to handle the fall.
Thanks, Jenna. Just one more kind of series of questions, and then I think I'll turn to our panel. A number of folks are talking about for families in care, when families go on vacation and perhaps go to hotspot areas, how should they handle that in terms of coming back to care? Any suggestions for that?
Oof, that is a very difficult one. I think this is one that has really just bubbled up in talking with our health colleagues in the last week or so, as you start to see, I just think of the maps of the country, and oftentimes they will use different colors, right, to indicate whether a state is trending up or down, and the kind of the number. I think the general kind of guidance still remains the same, right, which is a real focus on if you've been if you're kind of a confirmed kind of contact, right? So again, going back to what I said about the contact tracing, if you know that you've been within 6 feet, right, for 15 minutes or more with somebody who's confirmed, like, you really need to kind of get tested and quarantine. And so I would sort of, just really emphasize that with families. Obviously, if folks are traveling to kind of states that are concerning, like, you might want to do more, and that's a local decision, that's a program decision. I would consider, sort of think about, kind of consult with whoever you do on some of these tough choices. But the contact definition is really the key one that the Department of Health is going to focus on right now, rather than any blanket rules around, at least within the states. I think if, internationally, you might want to hold a sort of a higher standard, but at least within the country travel, to focus more on, were they within 6 feet, for 15 minutes or more with somebody with a confirmed case, and in which case they likely need to self-quarantine.
Thanks, Jenna. Yeah, appreciate that. I think we'll move now to our panel, and Val, if you'll move to the next slide. And Jenna, hopefully you can hang on a bit, because I have a feeling there'll be more questions that we'd love for you to help answer. Really excited today to welcome Lisa Payne Wells, who is the Executive Director of the Child Care and Learning Center in Rappahannock County, Angela Rouse, who is the Director of the Roberta Webb Child Care Center in Harrisonburg, and Tracy Walters, who is the Director of Family Care Services as part of VCU Health Systems here in Richmond. And really pleased that they have all been willing to jump on the call today and answer some questions. They have all been continuously operating and have managed to, tackle the very difficult task of managing the different and sometimes changing guidance and figure out how to effectively provide care for their families and young children. I won't put them under the pressure to say they have it all figured out or have all the answers, but I think they're willing to answer some questions for us today and give some good advice. I also know that I think Tracy has a hard stop with us at 1, so I may point a number of the questions to her initially. I would also say, and Jenna, you can sort of weigh in if what I'm saying is fair. After doing a good number of these briefings over the last few weeks and months, I noticed this dynamic where the state is able to provide, certain mandates and then certain guidance about what is, what can and should happen within childcare settings. I think there seems to be a really wide space in terms of using good judgment and making decisions. I'm sure this is frustrating when there are times that it feels that, you're used to following very specific regulatory processes and rules. And I think we're just in an environment when, all of the answers may not be particularly clear. And so I think that hearing from these directors today, I think, may help with showing how there are places where you need to look to the guidance, make best decisions, think about what is right for your program, and make decisions and act accordingly. I hope that seems like a fair assessment of kind of some of the situation that we get ourselves in based on the questions that I see come across. So with that, we'll welcome our speakers, and we have a set of questions for them. First, more around demand questions, and then around some supply. So Tracy, I think I'll start with you and ask you to answer a few kind of rapid fire questions about how many and what ages of children were you serving in January, and then how does that compare to now?
Sure. So in January, we were about 175 children just in this location. We have 3 locations, but I'll just focus on what my experience has been at this one, at the Health Systems Center. So we had 175 children in January, and then we maintained that until middle of March. And then some families who, I guess, understanding our population, one of the parents at our center has to be a health systems employee. So they're a physician, they're a nurse, or they do provide some service for the hospital. In mid-March, we saw that the second parent, a lot of them, their companies were shutting down or they were starting to work from home. So we had quite a few children that left at that point. What we did in support of families, just talking about revenues, is that we gave them an option for a $100 retainer fee. Not everybody has the option to do that. But we were able to do that for the families who are out. Our lowest point in enrollment during this has been 50 children. So we've always had at least 50 in the building. And currently we are back up to about 165. So we're just down a few children from our normal enrollment. We serve children as young as 6 weeks up to 6 years, and we are licensed to care for children up to 12.
Thank you, Tracy. And just kind of wondering about what you're seeing in terms of what parents are needing and wanting. Are you seeing more demand now for school-age children?
So we are just now really in the throes of talking about that, of course, because as we all know, we're waiting on all of our counties or the city to make a decision about what the final plan is going to be for children. What we've put out to our families, and of course this impacts enrollment, is our kinders who would be going this fall. What we've said to the families is that we will maintain enrollment for their child. And then depending on what their needs are for kindergarten, we will certainly have a spot for them here. One of the things that we're talking about is making a cohort of the children who may not be going, or even the days that they may be off, if it's a hybrid situation, and having one of our licensed teachers who could teach kindergarten K through 12 to actually go back with the group, so that we would actually have a kindergarten or mixed age cohort for school age children. That would mean we would have to have enough parents that wanted that option for us to actually, put a teacher into that role and make that commitment. But we are just navigating those conversations now, and I think it's likely that even if it's on a hybrid schedule, we'll be providing that education for children here.
And one more question for you, Tracy, before I turn to one of the others. Have you had need for, or how have you handled communicating with parents, helping build their confidence that your care is safe,
Yes.
Answering their questions fairly?
Yes, so this is so important. It's a trying time and a difficult time for everyone. I know our parent population, brought many fears and reservations because they are working with COVID patients. So they had their own reservations about their health and, their child's health. What I would say to anyone who is working with the program is over communicate, if anything. Over communicate, inundate them with information. We use several modes for this. We have a parent app that we use. We have a family Facebook page that we use. We have newsletters that we use, and then just direct conversation with families. But I think every night, really, when we were in the throes of figuring all this out, because you're kind of building the plane while you're flying it, I was posting. Probably 50% of my day was communication with parents just about these topics. And then at night I would go home and I would post what was coming up for the next day to be thinking about on our, our Facebook page or the app as well. So, and I think that really relieved a lot of anxiety for parents, because up front we were able to communicate things such as, this is going to be different for your child. Because what you're going to find is a lot of parents are going to want to know what's changed. What's it going to look like when I bring my child back? So, we indicated we're going to be wearing masks. The staff will be wearing masks. So talk to your child about that, before you bring them to the program. Let them know their temperature will be taken every day. And we learned some little tips, like if, when we took their temperature, we were like, as soon as you let us take your temperature, you can go right over there and pick out a sticker, so we had like, a pattern going with the children. So it became very routine. And after a week of really taking the temperatures and the masks, I can tell you the children, it's like old hat. It's like they've done it forever. One of the concerns we had just in terms of social emotional development and mental health for young children was teachers communicate so much, and especially in the infant rooms, but really all of our rooms, through our face and our body language. So we had a lot of staff meetings surrounding that. How else can we demonstrate to a child what we were communicating with them. So we had to use a lot of other tools with our body and our voice tones to make sure that they were comfortable with direction that we were given or conversation we were having. But really communicating all those pieces were really important.
And Tracy, I'm going to ask you one more question since I know you have you need to jump off, but because you mentioned sort of social and emotional well-being, I want to ask you this question that one of our attendees had asked earlier. Are we able to physically comfort or hug children, especially those children who are first-time program attendees, asking because I'm concerned for their emotional well-being? Just wondering how you handle that sort of issue.
Yeah, absolutely. So I think it would be, a falsehood to say that that is not going to happen in a classroom with young children. And of course, infants. I mean, our program has, 50 infants. So you're going to be holding those children. What we encouraged our staff to do with the children was, you can give a side hug, like put your arm around the child, let them like get to your hip instead of like a full body embrace that's really close face to face. Or if a child really wants to be held, make sure that their back is to you, and try not to have as much face to face contact. But of course, these children need that contact, and really more now than ever. So I think it's just using a few techniques in the classroom. When we're on a child's level, we make sure there's a good amount of space between us. Our teachers are always in their face masks, so there's no, none of the teachers' spew would be coming towards the child. But these are like simple things that you can do. And we also taught the kids some things like air hug, or we would say, elbow bump, because even your children, your smallest children, I mean, our 2-year-olds and 18-month-olds are doing that with us. So, just doing that, it's part of any routine in childcare when you think about the things that you want to make very comfortable and bring a normalcy back to the classroom. You just practice those things. And we have found that to be true for our children. I will say this, and I think this is interesting because I have a mental health endorsement, and so I'm always really thinking about that area. But I wondered how long it would take the children, once we made these changes, to start asking questions about them or talking about it. And it was not right away. There was some time in between, and then a couple of weeks, and they were like, well, why are you wearing that mask? It took them a minute to process that. And I think to give children just like honest answers when you are talking with them, this mask is to keep you safe and to keep germs from getting on all my friends. But our kids, honestly, we've had children with magnets build the COVID molecule. I can't keep up with them. So they hear a lot of information. And of course, we use the appropriate language for that. Yes, there's a bad germ called COVID. And we have conversations about that. Now, a few months in, one of the things we do with our children is they do a monthly self-portrait. And we collect these for the parents, as they go through the years of the program. We are beginning to see just now when children are doing their self-portraits, they're drawing masks on their faces, which is interesting.
It really is.
Yeah.
Tracy, thank you so much. And
Absolutely.
Tracy has graciously offered, and I think what I'll do is if you have a question specific to Tracy, if you'll note that when you ask your question, we'll make sure and get the questions to her, and she has offered to answer them. So thanks so much for being with us, Tracy.
Absolutely. Thank you for the invitation, and I wish everybody good luck and good health in their journey to reopening. And yes, please feel free to contact me. We've been doing this for a minute now, so we're happy to share our information.
Thank you so much.
Okay, take care, guys. Be well.
You too. Thank you. Now we're going to turn to Angela Rouse. Hopefully you are unmuted and able. Angela, are you with us?
Yes, I am. Thank you.
Awesome. Thank you so much for being with us. We're so glad to hear from you today. And I'm going to start by asking you a few of the same questions just to give us a sense of your program and what changes have happened, since the pandemic. And then we'll also bring Lisa in on these same questions. You want to tell us a little bit about the number of children and ages of children you were serving back in January, and then compare that to now?
Certainly. In January, we were serving 54 children ages 6 weeks to 5 years of age. And as of now, we are serving 28 children ages 2 to 5. So a little bit of a difference.
Very much so.
Yeah.
Could you answer the question about what kind of changes you're seeing and what parents are looking for and needing in childcare?
Yeah, we have had lots of requests for school age children during the summer, and we do not serve school age children at all here, but the request has been coming in so that I know that the need is here in our community. That's been a huge deal. We also have had a lot of parents request, and I've come even on the weekends when there are no other children here to walk through the center to see some of the changes and understand our safe pods that we've created for children.
Mm-hmm.
Yeah.
Okay. Helpful. Now, let me ask Lisa from Rappahannock County. Let's bring you in, and if you would just answer those same questions. How many and what ages of children were you serving in January compared to now?
So we're licensed for 90, and in January we were actually fairly close to that. We had about 85 children, and we ran probably about 55 in our child care program, which is 6 weeks to age 5. And then in our after-school summer camp program, the remainder of the kids. So usually somewhere between 25 and 30 children. And in June, we are down to 44 with about 26 kids actually in our child care program. The remainder of kids in our summer camp program. So we're at about half capacity. We've been there since mid-April.
And help us understand a little bit about what your parents are asking for. Are some of those reductions because of kind of the space requirements? Is it more because parents aren't using childcare as much? How are you looking at those changes?
Yeah, so we actually closed for about 3 weeks right after our school system closed. We're very closely tied to families that have children in the school system. It's probably true for many child care centers. But when the school closed and parents had to stay home with the older kids, our census dropped pretty precipitously then. And we were able to kind of extend some credits and opportunities to kind of stay enrolled for those parents who had made the decision since school was closed and they were able to work at home that they were going to keep the kids at home. So it wasn't directly related to COVID fears at childcare. It was more of I think, a practical issue. And we then reopened for essential personnel only for the month of May. And we had a very low census then. I think actually probably no more than 20 kids on site. And after the month of May was over, we began to contact our families again, letting them know that we were going to reopen at the phase 2 level in June. And at that point, we immediately filled up to the level that we can within the size restrictions in our classrooms. And we're currently running a waiting list, and we are in regular contact with our families that would like to come back, but we don't have the room for them yet. We made the decision to go ahead and keep our kids that are transitioning to kindergarten in childcare as well. So those kids are back with us in a classroom. So it's really, really about kind of the restrictions on classroom size. That's why we haven't been able to ramp back up. Yeah, and we are also in conversations with the school system, trying to kind of work alongside of them to figure out if we're going to be in phase 3 for a long time, how are we going to manage additional needs for childcare going forward in the fall. We don't have a lot of answers to that yet, but we are in conversation.
So along those lines and sort of shifting to some of the supply questions, Angie, I'll ask you first and then bounce back to Lisa. Have you needed to make any kind of physical changes to the center to meet the maximum individuals requirement, or what have you done in sort of creative use of space to try to serve as many people, many children as possible and still stay within guidelines?
So I would say, the most creative thing that we've done is create these safe pods, which again, we too closed right when the school closed, and we were closed for 2 weeks. And we took that time, one, to clean from, front door to back door. But we just took everything out of the classrooms and decided, what does keeping children 6 feet apart look like? What does it mean? And so we got out some painter's tape and taped off what at first I think it was like 8 foot pods, and we could only get about 5 or 6 kids in each class. And so we did 6 foot squares on the floor with a nice little sidewalk path that they could walk in. And then we just started creating, what do children need every single day? What kind of exploration could we put in this specific space for this child? So we came up with these little safe pods. And so I think some of the things that were interesting is that we needed extra tables because only 2 children would be able to eat at each end of this 4 foot table. And the 4 foot tables sort of adjoin the pods themselves. And then we also, we're going along with our conscious discipline and making sure every child had a kindness tree and family pictures and different things like that. So it kind of looks like their own little first apartment, but it's what they use, and it really helped us to be able to visualize it. And now that children are back in the center, it has helped them understand which safe space is for them. So that's probably the most creative thing that we have done. It's also been good for us to have the changes of our daily health right there at the front door. Our parents wait by their car or on a rug that's outside that we take the child's temperature on the inside and then give them a thumbs up that the child is well. And although we've done daily health, in childcare all the time, this is really nice to have that face to face with the parent as we are saying your child is well and they are welcome. So that's been a really good change also.
Mhm. By any chance, Angie, do you have pictures of your safe pods on your website?
They're not on our website, but I have them and I can get them out to you and you can send them out to folks.
That would be awesome. There is interest in that. Thank you.
Sure.
Lisa, how about you with the physical space requirement?
So we were in the midst, by the way, I just love the Safe Pods idea. I just made a note to myself. We may call you, Angie. That sounds like a wonderful idea. So we were actually already in the middle of construction, poor timing probably with that, but we had torn down another building that had held a preschool class before we closed. So we were already all kind of crammed into a very small building, and we're using every bit of available space as we had to move everyone back into the main building during construction. So there wasn't a lot that we could do with that. We have a 2 classroom, and that really is in a conference room now, which was our only spare space. But, I think as you just heard, I think we really focused our time and attention on creating as many kind of policies and practices within our building to kind of limit contact between classrooms, to really do some heightened sanitation of both our playground and inside our classrooms, kitchen, hallways. We had a lot of communications with parents, letting them know what was coming down the pike with masks and front door temperature taking. We purchased a couple of those kind of agricultural foot baths that are really relatively inexpensive. You fill them with sanitizer, and the kids come through those as they come into the building, so we're not tracking in additional kind of dirt and germs into the building. We really spend a lot of time with kids on getting them to wash their hands when they come into the building, wash their hands as they're leaving to go home. I know that's kind of a regular practice in childcare, but it really became something that we started really focusing a lot of time and attention on. And then I think most of our attention was really spent with kind of identifying and creating a greeter role. And I suspect other people have done this as well, because our teachers are limited to their own classroom. They're not moving from classroom to classroom. And we're not allowing the kids to kind of mix and mingle either on the playground or when eating lunch. We needed to have someone whose role it was to kind of be there in the morning to greet each parent at the front door, to take a temperature, to guide the child to their classroom, because parents at that point were not coming into the building. And, to kind of pinch hit if a teacher needed to kind of leave the classroom to use the restroom, for example, someone could stand at the door and watch her classroom for them while she went to the bathroom and then came back. That person also occasionally acted in the role of our cook in the kitchen, made lunch, and then brought the carts around to the front door, and the teachers then would kind of bring them into the classroom and then put the dishes back out, and we would take them back to the kitchen. So for us, it was really getting into the groove of new practices and a new process for the way that we move through the day.
Excellent. I have so many more questions that I wanted to pitch to you, but we're seeing so many great questions come across from our attendees that I'm just going to pull from this list and ask the both of you to answer as you wish to some of these. For example, someone was asking, and I've seen this a number of times, can you give a name of a good contactless thermometer that you would recommend?
Oh boy, I can tell you that the ones that we've had so far have been underwhelming.
Okay. Well, we don't want that name then.
We waited quite a bit of time to actually have one delivered. It's a lot easier to get a good one now. My guess would be, or my best advice would be, to kind of really buy the best one that your budget allows. They run through batteries really quickly. Mm-hmm. And from our experience, Angie, you might have had a different one, but they are consistently lower by a point or two than the ear thermometer. So we've kind of just, incorporated that information into what we're doing, so that almost everybody coming in seems to have an artificially low temperature. And if the child is otherwise acting kind of as though they're not feeling well, we do a secondary temperature taking with the ear thermometer. With our digital ear thermometer. And yeah.
Angie, any advice from you about a brand?
No particular brand. We too have gone through quite a few of them. The one that has been the best and requiring the least amount of batteries is I don't know the name of it, but Head Start purchased it for us, and it actually is a laser, and all we have to do is walk up to them. So it's been a lot more accurate than the ones that we purchased at Costco, and I don't remember what the name of it is.
Okay. We have a couple of folks who have mentioned what they're using. FAMIDOC non-contact thermometer seems great so far, and we purchased the AICARE AICare medical infrared thermometer, has been very good. So those are two suggestions that have come across from attendees. What kind of changes have you each needed to make in terms of touring your centers for new parents?
I tour on the weekends or after hours now.
Okay. Lisa, anything on that one?
Yeah, it's pretty much the same. We actually, during kind of our preschool process this year, through the preschool development grant, we started Parent Choice this year. And so we knew that we had to allow parents the opportunity to kind of visit each of the different participating centers. And those have been scheduled, by and large through our program director after hours, because we can't have kids come into the building. We can't have parents come into the building. So that's how we're handling that.
Mm-hmm. Any guidance or any experience with students brushing teeth in the classroom?
No, actually, our 2-year-old class is a Head Start classroom, and that is one of the elements that they have taken off the table for now. So there is no toothbrushing happening in our 2-year-old room right now.
Okay.
It's the same on our end as well. It was something that we didn't feel that we could safely control. So we're going to put it off for a bit.
A lot of questions about just the challenge of physical distancing with young children and sort of trying to manage that. Any great creative ideas? I love the pod idea, Angie. Any other thoughts about sort of managing that distance through the day?
Well, I just want to say that, for our 2-year-olds, that was our number one worry. Um, and I think most children, and again, this isn't, this is just what has happened for us. And I thought the honeymoon would be over, but it's still happening. I think that children needed some time, one, to be alone, two, to make choices of items, choices of toys, things that they wanted to do by themselves without a friend so close by. So at this point, we are feeling like, especially in our 2-year-old class, this is something these children have been wanting for a little while, their own space, their own stuff, and not having to sort of battle for it. So it has really helped in de-escalate behaviors, and great observation is being able to happen because there are not all these little fires that are happening. So I think just like we're telling adult people for our mental health to take some time to just be alone, this has been a really creative way for children also to be in control and to have an opportunity to make some great choices for themselves without having to sort of battle it out. So I just think that that's worked out really well.
Thank you for that. Next question, I'm wondering about how you have managed staff changes that you've needed to make over the last 3 months. What really keeps you awake at night regarding staffing, whether it's the risk to their health, identifying qualified staff who will work right now, keeping them employed and appropriately compensated. What kind of staffing concerns have you grappled with that you would share with these attendees?
That's a good question.
Mm-hmm.
There's a lot of things that keep me up at night, but I would say that, as because we are less staffed, I think, that time between 4 and 5, I'm like, please don't let my phone ring, because if a person doesn't show up, we've had to close the classroom because we're trying really hard not to have staff, um, you know, um, I was going to say cross contaminate, but be in one room and then ask to be in another room. Whereas before, I think we had such a practice of interweaving our children and our staff whenever we would bump up into a situation throughout the day. That no longer can happen. And so my fear is having to tell these parents who are just getting back to work again, by the way, someone's sick in this provider's house, or the teacher's house, or the teacher is sick, and now we have no backup. I think that is the thing that keeps me awake.
Mm-hmm. I can understand that. Lisa, anything more you want to add on that?
Yeah, I would just say that I think we're, a small county, and we have not had such difficulty, I think, in getting new employees, but we've had a number of employees that have decided to kind of sit it out. So we're operating with a lower number of kids, but also with a much lower number of staff. And so, I think what wakes me up at 2 o'clock in the morning is anyone getting sick. But it's also the reality that we have had to kind of shift our staff around in order to accommodate people who are either feeling like they can't come back or really are not safe at work because of their age or pre-existing medical conditions. So it's really, really difficult. Every one of the people on our administrative team is now working as the greeter in our child care center, myself included. That's how low staffed we are. And, we are trying very, very hard to kind of to get through this period when people will start feeling more comfortable returning to work, or when we will feel more comfortable in beginning to hire for some additional staff, but we're not there yet.
Mm-hmm. Yeah, there's so many questions that I'd love to ask you all. Our time is getting short, but I would like to ask 2 or 3 more questions that I think, kind of illustrate what I'm saying before about a lot of this is just best judgment and sort of making good decisions. And, they're probably not going to be specific, guidance or guidelines that you can look to give you a definitive answer. So as you answer these questions or give us your answers to these questions, maybe you could share with the providers on the call how you go about, thinking about what is required, what is best practice, how do you make these decisions? So, for example, questions like, what do you do about disinfecting the toilet, during the day in between uses? What is your practice around that?
So our practice is our bathrooms get cleaned by our floater 3 times a day. I did call licensing because I was on a phone call. I can't even remember who I was on a call with, but I was on another webinar and somebody was actually talking about, having someone go in and clean between children using each. And I just kind of freaked out and was like, we don't have enough people to do that. How do I remain excellent? And so my licensing agent said, well, take it up a notch. What one thing can you do better? And I said, well, we can do it 3 times a day. So that's what we're doing. But I think if we can sort of take that model as to what one thing can we do better next week than we've done this week, I feel pretty good about us staying very close to the orders that have been put in front of us.
Mm-hmm.
Yeah, I would absolutely agree with that. I think that's you can kind of make yourself crazy with the sanitation and what needs to be done and how regularly, and there's not great guidance out there. But I think the areas that are kind of high use, if you could manage to do it a few times a day, and also start kind of really reinforcing good practice. We had to, as part of our construction recently, this is probably true for a lot of child care centers, we did not have lids on toilets. So when we renovated, we replaced all the toilets with lids, and we've put reminders on the back of them to start training the kids to put the lid down before you actually flush, because obviously that creates a huge sanitation issue if you don't. So it's things like that that we've also been trying to reinforce at the same time, that we have this heightened sanitation, but also much lower staff.
Mm-hmm. Yeah, thank you. What would you each recommend for providers, or how do you speak to parents who don't want to wear masks when dropping their children at daycare?
Oh, that's a big one.
Yeah.
A very big one.
If we have parents who don't want to wear a mask, they can step on, we have carpet squares outside that are, actually they're probably 8 feet apart, and they can stand there, and we open the door and they can guide the child either into the gate if the children are outside already, or into the front door to get their temperature taken. And they don't come near us and we don't go near them.
What do you do about playground disinfection? How frequently do you disinfect between groups, or how do you manage that?
Yeah, so we had our playground professionally disinfected, right when we were beginning to reopen, and then we have kind of a pump system and spray down system that we use each time the kids are out on the playground. And we, for our summer campers this year, we rented actually space at our local park, and that is how we sanitize the equipment there as well. There are services that will provide that. We have one that works with our local school system, but it was not something that our budget would allow us to do. So, and in all honesty, we could not find out from that vendor how often was recommended. He didn't know. So that's kind of the way that we've managed that. But I think the larger issue is that there's often not great guidance for how much you're supposed to disinfect these things that our kids are using on a day-to-day basis. The bigger thing to us seemed to be really going through and screening the classrooms for anything that couldn't be washed on a daily basis or as the kids were using it. So we had to remove kind of soft things and also books that were not able to be kind of at least wiped down after the kids had played with them. Can I go back to the mask issue really quickly?
Sure.
We're in I guess what's known as a low mitigation county. Rappahannock has had very few cases. We have not had a death. And I think in some ways that makes people feel very secure that the disease is, not going to impact them or their family. And so we do not routinely have parents that are willing to wear masks. We've insisted on it if a parent wants to come into the building, which they have to do if they're swiping for child care assistance. And if they want to bring a child in with them that's over the age of 10, we've been insisting on that and actually handing out masks to families that need to kind of come in for one reason and they want to stand inside to do that business. But it has been really difficult, and we've had a few parents that have complained about it. But it's just a very, very difficult situation. Our program director has spent a lot of time communicating with parents at each phase and reminding parents of kind of what they can expect from us and what our expectations are of them. We post regularly on our Facebook page, but we still have a lot of difficulty enforcing it. And as a matter of fact, in most of the businesses within Rappahannock County, there's just a widespread problem with reinforcing the use of masks. So it's not easy if you're living in a rural area where people may have their own strong feelings about that.
And would you each be willing to share if you have guidelines that or flyers that you share with your parents about rules or post on your door? Is that something you'd be willing to share that we can share back out to folks on the call?
Oh, certainly. I would like to add just one thing too. When I think you asked Tracy about a child who might need to be closer to a teacher, and we actually now our teachers wear scrubs, and we have only indoor shoes that they wear indoors, and then we purchase 5 scrub jackets per teacher, and if a child, which happens on a daily basis, needs to be close just to be close. It doesn't have to be hurt or, no conflict happening. They just want to be held. Then our teachers put on a scrub jacket and snap it up, and they can sit and hold that child close to them. And when they are done, they just simply take it off and put it in the laundry. And then if they need another one, they have 4 others throughout the day. And then our floater does the laundry and gets the scrub jackets back in the classrooms so that if they need them again. And that's worked really well.
I'm such a softie. It just really makes me emotional to think about the extent to which all of you go to care for children. Really appreciate that.
Yeah.
One last question, just any kind of creative idea about how in the world you keep a line of children walking down the hall to go outside, stay 6 feet apart? How do you keep them apart at all times in the classroom? To the extent that you can give kind of a creative idea about this distancing, we'll let that be the last question of the day.
Well, I will tell you, I fell flat on my face a few times. I actually printed off the free footprints that say 6 feet distancing, and I stapled them to our long carpet in the hallway and then by the front door. And it was so slippery, no one could walk on them, but it was a great marker for the children. So now we're going to just align them on the wall, and we basically are just saying, okay, let's take a step. We've been doing this for, I want to say, 1, 2, 3. This is probably our 3rd week in with that, and it has really helped. And they basically are saying, oh, it's time now, let's take a step, and they step to that next marker. I know it has been on the floor, it's about to go on the wall because there's just been, I laminated them thinking I could save paper, and it's just a slipping hazard, and I think they're finding it kind of fun to skate on it. So we're going to put them along the wall and do the same thing. But again, it's just whatever, we have to keep trying. I don't think there's any one right answer, but if the first thing you try doesn't work, just put your mind to it, be creative, and think of what's next. So ours will be going on the wall next, and that's how our teachers will be guiding the children out to their play space or any transition to the bathroom.
Thank you, Angie. Any last word, Lisa?
No, I think that social distancing is really, really hard, particularly with the younger kids, much easier with our kids that are school age. The teachers have used a number of strategies. They are still having to be on top of it every single day for our toddlers and our twos. And I think that we're fortunate that our playgrounds open directly from the classroom, and they are separated by fences from other classrooms. So that's helped a lot on our end, but it is definitely not an easy situation. And I think our teachers have tried to kind of make it a fun activity, to let kids kind of be able to do things where they can, you know, interact with each other, but from a distance. But there's still kind of, I think, the longing on the part of these little kids to want to kind of be next to each other and to touch each other. So it's just constant vigilance.
Can't thank you enough for the information, Angie and Lisa. Really grateful. Loved hearing from Tracy earlier too. And Jenna, as always, thank you for the great information. And to the hundreds of folks who've stuck with us through this call, hope the information was useful to you. Best wishes to all. Stay safe. Thanks again for spending time with us today.
Thank you.
Thank you.